Namaste Vidya, Hamesha Khush raho betiya. A very good morning to you all. Myself, JV and Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine in Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In today's lecture, we are going to discuss about a new chapter, that is diseases of the urogenital tract. So let's start with this chapter. What is urogenital system? The genitourinary system or the urogenital system, it is the organ system of the reproductive organs and the urinary system. So we have reproductive system and as well as the urinary system that is included under this particular chapter. So all the diseases related to both the systems will be studied here. Why do we study both the systems together? We study them together because of the proximity to each other. First of all, their proximity to each other. Secondly, their common embryological origin. The origin is common in both the conditions. And the third one is the common pathways. So we have proximity of both the systems to each other, their common embryological origin, and the common pathways. Now, what are the systems or what are the organs or what are part of the body that are that will be studied under this particular chapter? We will be studying about the anatomy of the kidney and urinary tract. We will also be knowing about the physiology or the renal functions of the kidney. We will also be discussing about various renal disorders, the diseases of the kidneys. Next, assessment of the renal disorders, how to assess the diseases of the renal disorders we are going to learn in this chapter. And examination in the cases of renal disorders. So in this particular chapter, we will be studying about the anatomy of the kidney disease tract and the urinary tract, the physiology or the renal functions, the renal disorders, the assessment of the renal disorders, examination in the cases of renal disorders. Now, what is the anatomy of the kidney and urinary tract? You must all have studied the anatomy, and I have shown you the complete picture in the presentation. So in the anatomy of the kidney and the urinary tract, we have, broadly speaking, we have two kidneys with the major calyx and minor calyx. We have the renal pelvis, and through the renal pelvis, the ureter is coming. Both the ureters are entering the bladder, urinary bladder. And then through the urethra, the orifice is opening outside, having the internal and the external sphincter. In the kidney, the major anatomy consists of the cortical blood vessels. We have interlobular blood vessels. We have renal hilum, which consists of renal vein, renal nerve, and renal artery. We have the medulla, ureter, and the capsule. In the cortex of the kidney, we also have arcuate blood vessels with the minor calyx, major calyx, renal pelvis, pyramid, papilla, renal column, and the cortex. This is basically the renal kidney anatomy. Now, what are the functions of the kidney? In the functions of the kidney, the most important function of the kidney is to maintain the volume and composition of the body fluids. So we maintain the volume and the composition of the body fluids. The kidneys retain certain useful substances by the renal threshold. They also excrete waste products, which includes the urea, uric acid, and the creatinine. There is homeostasis of electrolytes, minerals, anions, and cations with salt and water. It is also responsible for the metabolic and hormonal functions. So the functioning of the kidney consists of maintaining the volume and composition of the body fluids, retention of certain useful substances by renal threshold, excretion of the waste products, which includes the urea, uric acid, and the creatinine, homeostasis of electrolytes, minerals, anions, and the cations, and salt and water, and metabolic and hormonal functions. Then I have shown you the anatomy of the male and the female genitalia. There is no need to revise the anatomy because I believe you must all have studied it in first year. And I have given you the picture or the diagrammatical presentation in the PPT. So you can go through the PPT again and you can revise that particular anatomy of the male and female genitalia. Now we come to the functioning of the male and female genitalia. The function of male genitalia is to produce spermatozoa and testosterone with pubertal growth, prostate and seminal vesicles. There is development of secondary sexual characters. The functions of female genitalia: the ovaries produce ovine hormone and development of secondary sexual characters. Now, what are the various renal disorders that we are going to study in this particular chapter? There are a lot of abnormalities that are related to the renal system. So let's discuss about the renal disorders that we are going to study in this particular chapter. The renal disorders that we are going to study is acute renal failure, acute nephritic syndrome. We are going to study nephrotic syndrome, chronic renal failure, asymptomatic urinary abnormalities, urinary tract infection, renal tubular defects, nephrolithiasis, urinary tract infection, obstructions, etc. So the common disorders that we are going to study includes acute and chronic renal failure, acute nephritic syndrome with nephrotic syndrome, asymptomatic urinary abnormalities, urinary tract infections with renal tubular defects, nephrolithiasis and urinary tract obstruction. Now, how to assess the functioning of the kidney? So, assessment of the renal disease consists of looking at certain features. Features like on the face, we can check for puffiness of the face. Swelling is present in case of renal disease. In the eyes, there can be edema. Edema or the swelling can be present. In the ear, there can be tophi. Tophi present in the ear that we have studied in the gout. In the neck, there can be jugular venous pressure for fluid overload that could be visible. In the skin, there can be purpura, bruising, and pruritus. In the extremities, there can be edema, clubbing, and peripheral neuropathies. So, assessment of the renal diseases can be done by looking at the face for looking by puffiness, in the eyes for looking at edema, in the ear for tophi, in the neck for jugular venous or fluid overload, in the skin for purpura, bruising, and pruritus, in the extremities for looking at the edema, clubbing, and peripheral neuropathy. Now, how to investigate a case of renal disease? Whenever a case of renal disease is coming to you, how to investigate that particular renal disease? The investigation can be done by number one, urinary examination, or you can say it routine urine. In urinary examination, you can check for the volume, the color and the transparency of the urine concentration and osmolarity, the specific gravity, the urine dilution and the pH. So in the urinary examination, we can check for the volume, the color and transparency, the urine concentration and osmolarity, specific gravity, urine dilution and pH. Now we come to the abnormal constituents of the urine. What are the abnormal constituents that, if present in the urine, will direct your attention towards any sort of renal disease? The abnormal constituents includes protein. If present in urine, it is known as proteinuria. If blood is present, it is known as hematuria. Sugars can be present. Ketone bodies can be present. Bilirubin, cells, cast, crystals, and microorganisms. So abnormal constituent of urine consists of proteinuria, hematuria, sugars, ketone bodies, bilirubin, cells, cast, crystals, and microorganisms. Now we come to urinary tract infection. This is a very common disease that we are going to see in our day-to-day practice. A lot of patients are suffering from urinary tract infection, especially females. So let's discuss in brief about urinary tract infection. You get a short note on this particular topic. UTI is defined as the presence and multiplication of bacteria in the urinary tract. So there is presence and multiplication of different types of bacteria in the urinary tract. It can be uncomplicated or complicated, both related to the upper and the lower urogenital tract. The clinical features includes the diagnosis. The clinical features, the diagnosis of UTI, the treatment and prognosis depends upon the organism that is involved, that is responsible for particular infection, the site of infection, and the structural and functional integrity of the urinary tract. So the clinical features, the diagnosis, the treatment, and the prognosis depends upon the organism that is responsible, the site of infection, and the structural and functional integrity of the urinary tract. Now, what is UTI? Urinary tract infection that affects the part of the urinary tract. If it is affecting the lower urinary tract or the bladder, it is known as cystitis. If it is affecting the upper urinary tract, it is known as pyelonephritis. So inflammation of the bladder is known as cystitis, and inflammation of the upper urinary tract is known as pyelonephritis. And what are the different signs and symptoms of urinary tract infection? The signs and symptoms includes burning with urination. Means there is burning while urination. There is frequent urination. There is pain above the pubic bone or the lower back. So there is burning in urination, frequent urination, pain above the pubic bone or the lower back. With flank pain can be there. There is fever, nausea, and vomiting, and rarely bloody urine with pus in urine. So the signs and symptoms includes burning with urination, frequent urination, pain above the pubic bone or the lower back, flank pain, fever, nausea, vomiting, and rarely blood in the urine, and also pus in urine. And what are the different causes of urinary tract infection? The causes of UTI includes E. coli, Staphylococcus saprophyticus, urinary catheterization, intercourse, and contraceptives, which includes spermicides, diaphragm, etc. So the causes of UTI is E. coli, Staphylococcus saprophyticus, urinary catheterization, intercourse, and contraceptives, which includes spermicides, diaphragm, etc. What are the various investigations that could be done in case of UTI? In case of UTI, we can go for urine analysis, which includes midstream urine. Urine may be turbid, blood-stained, or foul-smelling. The pH depends on the pathogenic bacteria, the bacteria that is present. Mild proteinuria can be there with urine microscopy that shows pus cells and pus cell cast. Ultrasonography can be done with plain X-ray KUV. Intravenous urography can be done with CT, DMSA, and cystoscopy. Now, how to manage a case of urinary tract infection? There are various medicines, homeopathic medicines, which can be given. Few of them includes Thuja, Nux vomica, Sarsaparilla, Aconite, Apis, Belladonna, and Barbaris vulgaris. Selection of these medicines depends on the totality of these symptoms. Other medicines includes borax, cantharis, staphysaria, clematis, sulfur, and lycopodium. Now it's your homework to write the indication of each of these medicines that are related to the urinary tract infection. So this was all about today's lecture. In the next lecture, we are going to continue with acute kidney disease. So this session is powered by digital version 2.0 JAYOTI VIDYAPEETH Women's University. I hope this session is clear to you. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. Have a good day.